Hi, and welcome. I'm Daniel Nyman, Director of Business Development for the Forum for Healthcare Strategists. On behalf of the Forum, as well as our colleagues at Amsive, it's my pleasure to welcome you to accelerate patient growth with predictive modeling. In an era of healthcare consumerism, finding your next best patient requires more than broad-based marketing. It demands precision and predictive insight. Today, you'll hear from marketing and data leaders from Amsive and Better Health Group about the power of predictive modeling in transforming healthcare marketing. You'll learn how smarter modeling and refined targeting can accelerate patient acquisition, increase marketing efficiency, and fuel long-term growth. A couple of housekeeping notes before we begin. First, we will be conducting 2 audience polls during the program, so please be sure to participate when those appear on your screen. Second, if you'd like to ask a question, please enter it into the question and answer pane located on the bottom of your screen at any time. Our panelists will respond to as many questions as they have time for. With that, I'll turn the program over to Craig Blake, Healthcare Practice Leader at Amsive, who will be leading today's discussion. Craig?
Dan, thanks so much for the intro, and good afternoon, everybody, and welcome. And thanks for spending a few minutes with us today. Very excited about what we're going to be sharing. Got a lot of great information. I've got several case studies, including a live case study that Lindsey will be discussing with us today. But before we get started, again, my name is Craig Blake, Healthcare Practice Lead, and excited to be doing this alongside my friend and partner, Rick Berman, and new friend, Lindsey. And why don't, Lindsey, take a moment to introduce yourself, and Rick, you can follow that as well.
Good afternoon, everyone. Excited to be here with Craig and Rick and share some of the wonderful things that myself and my team have learned along this journey. But like Craig said, my name is Lindsey Pierson, and I am the current Vice President of Clinic Growth at Better Health Group and have been in the healthcare industry for 10 plus years.
Great, thanks, Lindsey. And Rick, how about yourself?
Yeah, thanks, Craig. I'm Rick Berman. I'm also the healthcare practice lead at Amsive. Actually started healthcare at Amsive about 13 years ago. It's our largest practice. We're a performance-based agency focused on growth, and really excited to be here today.
Great. Well, appreciate the time and effort you both put into preparing for today. And thanks to Daniel and his team for organizing this. So let's jump into it. You know, when we do these fireside chats and webinar conversations, I always like to start at a 30,000-foot view. And Rick, why don't you help us set the stage today? You know, here's a question I'm going to ask, and you can kind of walk through the information that's in front of everybody. But what are hospitals, health systems, and other medical groups? What are they facing and dealing? What are we hearing from clients and in the industry right now?
Yeah, I think when we talk to healthcare leaders, a few common pain points always come up. Data, for example, it lives in too many places, and it makes it really hard to get a complete picture of patients and then of your campaign performance. And that creates issues such as that high-value patients often slip through the cracks. And at the same time, provider schedules don't always line up with where the demand really is. And so everybody wants to grow, of course, but the other main issue we hear, and I'm sure Lindsey will cover this, is that growth has to make financial sense, which means you have to really show that ROI and the value of every marketing dollar. Those are the kind of things I think that we'll unpack today. And more importantly, we'll talk about how modeling can help you overcome them.
Yeah, Rick, that pressure to prove ROI, I'm sure just we'll do a virtual show of hands. Everybody's struggling with that and dealing with that in today's marketing environment. And that's just not in healthcare. We're seeing across our client portfolio, across many industries. But Lindsey, is there anything that rings true to you on this list, or maybe there's something on this, not on this list, that you'd like to add?
Yeah, echoing what Rick said, definitely data pain point for me in my current role, and patient attribution by channel, which Amsive has done a wonderful job at helping us solve for that problem. And as marketing and healthcare particular becomes more personalized, patients are demanding a very personalized patient experience. And as we have seen a decline in ROI on traditional advertising historically, where we've taken a very broad approach, what we're going to cover today is how can we cast a smaller net, but be more predictive with who we're casting that net to, so that we can see an increase in ROI and a decrease in our cost per acquisition.
Yeah, Lindsay, love what you said there. Something that really rings true is that, you know, I like to call it consumerism, right? What consumers are expecting today. You know, we're getting to a point where people are going to want to order their healthcare like they order their Starbucks coffee, right? Because it's so easy to do some of those tasks. But let's jump into predictive modeling for a minute. Hey, Rick, can you kind of just set the foundation and kind of describe what that all is in case people aren't in the know and why it's so important in today's healthcare landscape?
Well, I think it's like you said, Craig, and also Lindsay covered that consumers, I guess healthcare itself is becoming more consumer driven. I mean, people want to be able to make choices about where and how they can get their healthcare, like the Starbucks, like that e-commerce world, like Amazon, and so that means that the old spray and pray marketing just doesn't cut it anymore. And what predictive modeling does, it really helps us focus on the right patients, the right targets, the ones that are most likely to need care and most likely to take action. And that allows you to cut down a lot on your marketing spend and be much more efficient. It's really about being smarter with your marketing, not just louder. And so
Yeah.
I think that's the way companies are getting this, an improved ROI.
Yeah, and it's funny, you and I have been doing this together for a long time, and there's a quote I'm going to flash up on the screen that you introduced me to, but the quote outdates both of us. Why don't you just kind of share this thing that you love to tell people?
Yeah, so John Wanamaker was a retailer in Philadelphia, and although this quote is over a century old, it still hits home in healthcare today. Too often, we invest in broad outreach without really knowing what's driving patient growth, and predictive modeling really changes that. Instead of guessing, we can identify who the right patients are. We can run smarter cross-channel campaigns, and then we can really measure what works. And that's what Lindsay and I will be sharing today.
Yeah, that's great. So love that quote, Rick, and thanks for bringing that back up to us here today. You know, let's talk about this for a second. You know, break it down for me. Like, what are the steps involved to building models? Let's say I work for a health organization that's never done this before. I'm sure there's a few folks on the phone that have not done it. That's why they joined us today. It's always a good refresher if you've done this 100 times over. But what are the main steps?
I think typically this is what we do. There's a lot of different avenues. But first, we want to get a baseline. So that's with a profile. Profile, think of it like a portrait of who your patients are, and we want to compare them to the prospects in your service area. And so we want to find out what they are in terms of demographics, lifestyle, behavior, and then again, who your patients are, who you're attracting now versus who you're trying to attract. And then from there, we would group those people into clusters or segments. And just to give you a couple of examples, maybe you want to look at who is an oncology patient versus a cardiology patient. Or I want to look at urban locations versus rural. Or I want to look at millennials versus Gen Z. And then from there, those are building blocks. And then what we can do with that information is build predictive models. And what models are simply are using things from the past to predict the future. So in the case of what Lindsay and I are going to talk about today, patient acquisition growth, we would use statistical tools, typically something like logistic regression, to analyze current patients to find prospective patients that look just like them. That's really how it all boils down.
Yeah, that's great, Rick. Thanks for that 101 overview, right? I feel like I just sat in class for college class. But modeling, as you mentioned, can be used for a variety of different things. I think on the screen here, we've got a bunch of them. Highlight some of the top ones that you're seeing being used by healthcare organizations today.
Yeah, so obviously Lindsay and I will be, in just a minute, we'll be talking about how she used predictive modeling specifically for patient acquisition growth. But modeling really can be used across the entire patient journey. For retention, it flags those people that are at risk of leaving you so you can intervene. For care progression, It identifies patients who might be likely to drop out, and it would trigger timely support. For prevention, it could help spot high-risk individuals earlier so that you can be proactive with those people in order to get screenings. So it really just goes across the whole journey. It can be helped with things like capacity planning and demand, so you can align your resources better. We have a lot of clients who even at a strategic level use modeling to figure out, based on my patient database, where should I put my next location? What area is underserved, and where should I invest next? So really, in short, predictive modeling delivers insight that improve outcomes and drive growth at every stage of the journey that your patients are going through.
Yeah, I love that, Rick. Thanks for that overview. I said 3 and you did like 8, so that's great. Lindsey, for you, what rings home? And I know, Lindsey, you've been around healthcare your whole life, right? This is like something, this is a family deal for you, right? What have you seen work in the world outside of what we've done with you here?
Yeah, so like Rick said, I mean, for us, our approach was 100% patient growth. We had clinics that we needed to fill, and aside from that, looking at and started dabbling in how can this help us with capacity planning? How can this help us with new locations or underserved areas or market expansion? So this goes way beyond patient acquisition and such, which was eye-opening for me. You know, when you have your growth hat on and you have clinics that are open, it is really neat to look at it from a perspective of, outside of filling the clinics that we already have opened, how can we work together and partner to better serve other communities?
Yeah, love that, Lindsey. You know, that rings home. You know, when we think about growth, we think of it holistically. Growth really has 3 pillars. One is obviously patient acquisition. The second is clinic expansion. And the third is doctor and nurse recruitment, right? So all 3 of those can leverage the statistical modeling to help make sure you're talking to the right people. And most importantly, going back to the ROI comment, spending your dollars in the right place. And Dan, I think this is a great time for our first poll question, don't you think? Excellent. So hopefully you're seeing this flash up on your screen, the first poll question. I'll read it in case the type is small. You know, how would you describe your organization's current approach to patient acquisition? Item number 1 is casting a wide net and hoping it works. 2 is using some segmentation but not predictive. Or 3, testing predictive modeling in select areas. Or number 4, actively scaling predictive modeling. So Rick and Lindsey, going to have you both come off mute. Why people are entering their answers in, and Dan's doing all the number crunching in the background. Any predictions on what you think people are going to say?
I am going. Okay, I'm gonna go somewhere between using some segmentation but not being predictive quite yet. So that's where I'm gonna stand. Second selection.
Right in the middle. Love it. Love it.
Yep.
Rick, how about yourself?
I was going to say 2 and 3, you know, those 2 in
Okay.
between, but I'm sure some folks are using modeling all the time.
Well, great. Well, Dan, we'll do a drum roll. And look at that.
Look at Lindsey right on the ball.
Winner chicken dinner. Love it. Well, that's great. You know, and that really helps us really make sure that we're sharing content that's relevant. And really, I think you'll gain some value out of the next couple slides to come as we start talking in a little more intimate detail about really using modeling to drive growth in the business. So thanks for everybody participating in the poll. We will have another poll coming up later on in our session today, but I'm going to advance the slide here. And Rick, so let's talk about the data we need to use to fuel these models. Right here at Amsive, we have our audience science framework. Why don't you just give an idea to the audience? How does this become the foundation to drive these insights and drive better marketing and investments?
Yeah, audience science is just Amsive's way of taking the guesswork out of patient growth. What you're seeing here are some facts about our multi-source national consumer database, which is called Exact. And in healthcare, what does that really mean? It's blending your first-party data, like your CRM data, with third-party data that we have, like consumer behaviors, social factors. And again, in this case, it's our exact database. And then what we're doing, we're building those profiles and predictive models to score who's most likely to need a specific service or provider. And most importantly, we're doing this in a HIPAA compliant framework. And once we do that, the result is a clear picture of who is likely to engage and how to reach those targets. And then the idea here is that healthcare companies can scale growth in a very responsible way, again, focusing on that return on their marketing dollar.
Yeah, great, Rick. And one of the things that I think made this successful for Lindsey and other clients we have is these aren't pre-packaged models. It's not like we have an off-the-shelf shrink-wrapped acquisition model. We're using client first-party data to make it really predictive to where they are in the country, in the population that they're serving, right?
Actually, we're using these models, not building custom models based on each client's specific engagement, based on their patients or the particular channel that they're trying to focus on. But we're actually, not only do we do that, we localize it, right? We try to, no two neighborhoods are the same, I like to say. So if you have, clinics in one region versus another, we might look at it completely differently because people are going to be different in those two areas.
Yeah, love it. That's a great example. So before we get to Lindsey's story, we got a few examples to kind of prime the pump, if you will. Rick's going to talk just through case studies that may resonate with some folks. We want to try to make sure we're talking to everybody here today. So Rick, why don't you walk us through each one of these quickly?
Sure. This was a health system that used predictive modeling and coordinated campaigns, and they wanted to grow their outpatient panel. And over 4 years, that grew close to 300%. And at the same time, they were able to cut their acquisition cost in half.
Yeah, that's great. Let me go to the next one here.
This is an urgent care provider that has over 55 clinics, and with predictive modeling and geo-targeted campaigns, they were able to drive 6,200 new patient visits, and they generated a 7-to-1 return on the marketing dollar. So real excited about that particular example.
Yeah, who doesn't love you spend $1, you get $7 back? Come on, I'll do that all day long. Rick, I know you like Vegas. Would you take those odds?
Those are good odds. And the key here is, I always joke about this slide, is that there's 748,897. The data, the fact that we can actually pinpoint how much revenue was generated from this particular campaign. That's another big feature of being more sophisticated and precision focused on your campaigns. You can really get that ROI, which again is so important. I know Lindsey will talk about that in detail.
And
then lastly, this particular case study, we built 2 dual predictive models, one to identify high-risk patients and another to really pinpoint influential caregivers. So this health system was able to reach both groups with different messaging and connect more people with timely and comprehensive cancer care. So again, the patient journey is broad, and so modeling can be used across a different spectrum. And I know we're going to talk a lot now, which is great, about how Lindsey used it for patient growth.
Yeah, that's great. Thanks for reviewing those. Hopefully those resonated with the audience. And just want to do a quick reminder, if you do have questions, please use Zoom's Q&A feature and enter those. We are monitoring those, and we'll get to as many as we can at the end of today's presentation. So Lindsey, it's prime time. Before we jump into the results, let's give a little backstory, please. Tell me what brought you to the business need of knowing you needed to do live modeling. What was the tipping point? Was it a meeting with the executive team? Bring us into your world a little bit. What was that life like 2 years ago before we all got together and started doing this?
Absolutely. We were expanding at a rapid rate, so our budget was increasing, and we knew that we needed to be a little bit smarter with those dollars, and we were getting pressure to lower our cost per acquisition. I don't know any marketing team or department that does not have those same conversations with their leadership team or with their finance team. But at the end of the day, it was, how can we bring more patients into the organization and spend less money? And the approach that we were taking, it wasn't working. From a direct mail perspective, we had, a simple formula in place where we would mail households 64 and a half, age up, around a certain mile radius around the clinic. And that was the extent of the logic behind who we were mailing to and what households we were trying to reach. So we knew for direct mail to be a viable channel for our organization, we needed to really work on lowering that CPA. And transparently, we needed clinic specific plans around that. Not every clinic, I think Craig or Rick, one of you touched on this before, not every clinic or retail space is going to look and feel the same from a community perspective. So you might have a clinic in a rural part of the country that your radius is just going to be larger. You're going to cast that net wider because people are willing to drive a little bit further for healthcare. Whereas if you're in a more urban setting, 3 miles might be the limit because 3 miles could end up being a 30-minute drive. So it really, really depends upon where you're trying to grow and each individual location.
Yeah, and Lindsey, you guys felt that geographic difference fully, because you guys are in Florida, which has rural and urban areas, and we're Oklahoma, right? If my memory is correct.
Correct, and Alabama as well.
And
So
Alabama, right?
yes.
Yeah, you can't. Very unique. So that really helps you understand how to target people specifically in Birmingham and Huntsville are very different, as well as Miami-Dade and where you live in Central Florida. So that's great that was able to do that, and you're able to solve it. I'm sure there's other people that can identify with that same business challenge. So, Lindsey, I know you're competitive. I know you go to horse competitions with your daughter every weekend. You like to win, right?
Yes, competitive by nature. I will say it runs in our family along with healthcare.
Yeah, so why don't you bring everybody up to speed on the results?
Yeah, absolutely. So right off the bat, we saw an increase of qualified leads coming in, which was wonderful for our inbound team that manages all of those leads on the phone or form fills. So getting that team leads that they could actually place in our clinic was exciting, and they were excited. So we got that team re-engaged. So from a personnel perspective, win number one. And then just going through all of them, 74% of all appointments came from the 3 top deciles that we mailed to. So I'll let Rick get into the science behind that, but the fact that we can now predict where our patients and the appointments are coming from, it allows us to have those individualized plans at a clinic level. So not every clinic or every state is going to look and feel the same anymore from a budgetary standpoint. We also saw an increase in the number of appointments that we were able to make. We exceeded our goal, both from a new patient appointment scheduling perspective and from a CPA perspective. And our conversion rate, it was really strong. So the people that were calling in, they were qualified. They were ready to make a decision, and our team was actively able to schedule them in real time.
Yeah, that's great. 47% of people that are interested in coming to your clinic converted to new patients. That's game changing, right? Those are some really great numbers. Now, you mentioned something, and maybe Rick, you can just help clarify this for the group in case they don't know, that top 3 deciles were predictive. Rick, what does that mean? Just so everybody's understanding what that is.
Yeah, everybody said, oh, I didn't know there were going to be math, but decile is just a nice way of saying the top 10%, the top 20%. We break when we score all the people likely to respond in a model. When we say the top 3 deciles, that's the top 30% of those people. And so you think back to that John Wanamaker quote where he said, a half of my advertising is wasted. So here is a great way to say, okay, with 30% of the actual targets, I can get 75% of all the actual leads. So it's a much more efficient way of marketing. And again, it eliminates that idea of spraying and praying.
Yeah, that's great. Thanks for that clarification. Love these stats. I'm sure there's people on the phone today that would love to see some performance like this in their marketing campaigns. Now, Rick, in Lindsay's case here, she was using it to drive direct mail. She was targeting an elder population, 65 plus. So direct mail is a workhorse there. But can modeling be used across channels? Talk to us about that.
Absolutely, and in fact, that's really where the magic happens. The model is just step one. What we do is we can take that modeled audience and activate it across channels. So as Lindsay mentioned, offline with direct mail, or outdoor, we can use, for example, digital out of home. And I know Lindsay's team use that modeled audience for things like paid search and social and CTV streaming and programmatic, all the online channels. So the idea here is that you are approaching that target wherever they might be looking for your message. And because the targeting is sharper, your budget will go further and resources are allocated in a smarter way. And the good news is that we can measure everything based on, in Lindsay's case, those important KPIs, but it's really, again, client-specific KPIs. And so we can then optimize as we go. And so we don't just let them run. That's the praying part, right? We optimize as we go.
Yeah, that's so efficient. So just to bring it into real world, as I'm sitting there watching my Sunday football on YouTube TV, I'm going to get an ad that's catered to me. Monday morning, I could get a direct mail piece that is associated with that connected TV ad. I get an email, and oh, by the way, when I'm doom scrolling, right, I think we all do a little bit of that on our phones, I'll be seeing digital ads presented there, and it's all from the same campaign. And that's really the power that modeling can bring to cross-channel campaigns, right, Rick? Am I painting the right picture?
You are, and it's all done in a compliant way. So it allows you, again, to be more efficient, reaching the people who are most likely to take the action you want them to take, and not focusing on the people who are not going to take action anyway. And so that allows you, again, to spend your marketing dollars more wisely.
Yeah, I love it. And it's fascinating as we've been working together in the healthcare industry for a number of years. 5 years ago, you looked at the 65 plus population, you didn't really invest many digital dollars, but we've seen that change significantly over the past couple of years. And in fact, we always track celebrities that are turning 65 because it's kind of interesting. And this year, Tim Cook, CEO of Apple, turned 65. So that really paints a different picture of seniors and how they're using technology to engage. So I guess a shout out to the audience here as you're thinking about strategies. Make sure you're thinking about all the channels available. People like my 80-year-old dad probably is not streaming. I know he's not scrolling on anything. But there is a younger population that are active online. So make sure you're being holistic in the way you're approaching that. So Lindsay, let's jump to this next one here. So how do you translate the results? So you had a great year, right? Everybody's celebrating. I'm sure there's a few high fives. How does that translate into future strategies?
Okay.
Thank you. I would say continuous optimization is always important. This is a revolving education, as I like to call it, and you have to be able to make changes and adjust accordingly. And ultimately, the results are going to fuel your next campaign. So you're going to take what you learned, you're going to do some A and B testing, and it can be simple things like photography. What tagline worked better? What call to action worked better? Are you doing a form fill or a phone number and things like that? So continuing to make sure that you optimize, make sure that you're testing and allow those results to dictate what you do next. And I would say expanded use. Predictive modeling now supports both consumer direct mail and our field marketing efforts. So this is beyond, the traditional direct mail. We have a field team who does a lot of amazing work out in the communities that they serve. And we're using this same modeling to invite prospective patients into our clinics to get to meet the doctors, themselves and allow them to be a part of our story and ultimately help them make a very important decision. I mean, choosing who your primary care doctor is, it's personal, and we want to welcome those people into our clinics.
Yeah, that's great. Big question I have, when you get great results, talk to us about managing some of those executive expectations, because they're probably like, ooh, just, rinse and repeat, let's do this again. Expectations on performance must have gone through the roof, right? So how did you manage and educate them to make sure that they weren't giving you unattainable goals in year 2 and year 3?
Yeah, I would say a good question, Craig, and it ultimately comes around being proactive in those conversations. Year 1, we saw a significant dip in our CPA. So you're not going to necessarily see that same reduction from a percentage perspective from year 1 to 2. We went from 0 to 1 and now we're 1 to 2. Hopefully we see a lift, but we made such substantial progress the first year we partnered together that it's managing those expectations that year over year, it might look and feel a little bit different. But ultimately, where we get excited as marketers is what is the A/B testing that we're doing, and where can our creative team have a little bit of fun and engaging the leadership team on what the goal is. And if the goal is, we want to hyper focus on what types of mail we're sending, or like I said, what that messaging is. But I think it's being proactive with those conversations and really ensure that the data is doing the talking. At the end of the day, Amsive prepares a wonderful data package for you. And you'll know at the state level, at the service area level, all the way down to the market level, what's working and what's not, and allow that to make the decision.
Yeah, that's great, and appreciate the shout out there. You're very kind. It is all about the data, right? Because data drives decisions, and that gives the executive the confidence of what's coming down the road. Rick, any thoughts here? You obviously are managing clients and in this day to day. I'm sure you've got a few thoughts.
Yeah, it's Lindsay said, it's really a continuous learning loop. So, from a practical point of view, all the results from the first campaign get fed back in to the next one, and so the models become stronger. If you think back to the first case study we shared, we said that this particular health system grew their outpatient panel close to 300% over 4 years. The models get stronger every year when you are able to feed the information back into it. The other thing that Lindsay talked about, which is maybe something proves successful in one area or one market, we can then take that information and customize the next campaign based upon it. And so you really have to look at each one and feed it into the next phase.
Yeah, that's so important. So appreciate that perspective. This next slide is really one of my favorites to talk about, because modeling just doesn't live in marketing, right? To be successful, you need to, share first-party data. You need to have contracts signed, BAs, to make sure everybody's protected and safe. You got to involve other work groups, other stakeholders. Lindsay, talk about what the journey was like for you. We deal with it and consult clients all the time on it, but bring us into your tent a little bit.
Yeah, I would say this slide explains it and walks it through pretty perfectly. Engage early. I would say, I think as marketers, we often are a little bit too enthusiastic with timelines. So start early, have those conversations now. I'm sure a lot of us are already in round 2 of 2026 budgeting season. If you're anything like me and what I spend my nights and weekends doing right now. But start that conversation now. Engage your finance partners, engage your legal team, and get all that done now so that the fun and the work can really start. And start educating yourself on the process. I can't tell you how many meetings Rick had to join early on with the team just to re-explain or answer questions, because it was a new process for us. So the learning loop never ends. And we are continuing to learn more about where we are heading with predictive modeling. So I would say engage early and start the process now, and make sure you're partnering with an organization and team that is really going to integrate into what you have already established, because at the end of the day, it's a partnership.
Yeah, I love that. Starting early is so important, and there's positive byproducts of this, right? So coming out of this, you now have built better relationships with these work groups that might have just been transactional. Legal might have been just forwarding back and forth, but when you're collaborating with them to grow the organization, you've built a stronger bond with them. So I'm sure that that's helped too for the long-term benefit.
Absolutely.
Yeah, great. Dan, I think we're ready for poll question number 2. So here we go, everybody. What feels like the biggest or your biggest barrier to expanding predictive modeling? Item 1, limiting budget resource. Number 2, privacy or compliance concerns. 3, gaps in internal expertise or bandwidth. Or 4, difficulty proving ROI to leadership. So Rick, I'm going to go to you first. Any predictions on where this is going to land?
I think can people pick all 4? I think, no, I'm just kidding. I would probably say either 1 or 4 is going to be the challenge.
Lindsey, are we going 2 for 2? What do we got?
Let's see. Lindsey's probably going to go.
I'm going to go with 1 and 3.
Oh.
All right. We get a drum roll, Dan. Let us see what we got. Lindsey's on fire. I'm telling you.
1 and 3. Look at her.
Look at that.
Love it. Yeah, not surprising. So budget and resources, absolutely, because it does take time and effort. But from a budget standpoint, keep in mind, and something I'd share to your executive team is you'll ultimately save money because you'll be more efficient, because you're not spending all the budget on all the people. You're spending on the people with the highest propensity to convert. And gaps in internal expertise and bandwidth, that's why these webinars exist, to help close those gaps. Share this recording, share the artifacts that come out of it to help close those gaps with your leadership and team members that might not be intimately familiar with it. So Dan, thanks so much for sharing that. Hey Rick, I'm going to stay on this slide for a second. What would you say, and this kind of ties really nicely into the poll, what would you say to a healthcare marketer who's skeptical about predictive modeling? What would be your suggestions there?
Yeah, it can sound like like a buzzword. I would say, just like Lindsey mentioned, start small, see for yourself, run a test, a statistically significant test, compare results, and I think the value will become very clear. Again, as you said, Craig, modeling reduces your cost. It doesn't increase your cost. Everything in all those case studies, the common element is ROI and reducing cost per acquisition, because that is the most important KPI on a lot of the clients that we work with. It can sound complicated, but once you see the impact, it will really click. And it's really not about replacing your existing strategy. It's about giving you better tools to make smarter decisions.
Yeah, 100%. That's great insight there. Lindsey, anything to add to what Rick said?
No, agree 100%.
Great. Well, let's just move on to the next one. We're going to play a little predictions with predictive modeling. So crack out your crystal ball. Lindsey, where do you see predictive modeling going in the future? What do you think some of the opportunities are?
I think hands down, it's going to be a little more personalized, and you're definitely going to see this grow legs in the digital space. Craig, you said earlier, the 65-year-old today, at least when we're talking in my world, so Medicare Advantage, healthcare for, people 65 and up. The 65-year-old today is very different than the 65-year-old 5-10 years ago. And we are already in a digital era, and those people that are aging into the Medicare space are younger and younger. I mean, I always joke that, my dad is on his iPhone or Facebook more than my brother and I. And if you would have asked 5, 10 years ago, it would have been a very different story. So as I have parents that have recently aged into the people that I'm trying to market to, I often look at them and say, where are they spending their time? Where are they absorbing information and news?
Yeah, it's almost like, and it's just not the over 65 population, but it's almost like healthcare in general needs to
Mhm.
catch up, right? Because consumers, as I mentioned before, they're ordering their Starbucks coffee on their phone. All ages and all demographics are doing that. They're, doing so much on their mobile apps. And it's interesting, retail has always taken a lead in those kind of things, with technology and engagement and personalization. And it's healthcare, different beast, but always been a little bit of a lagger. But we're seeing it really jump fast now, in trying to meet consumers where they are. Rick, I know you and I talk about this offline all the time. Any thoughts here about predictive modeling, where things are going in the healthcare industry?
I don't know how I mean, Lindsay's 2 for 2 with the polls, so she's going to be the best person when it comes to the future. But the only thing I'll mention, other than what Lindsay said, was also about how AI is reshaping healthcare marketing in ways that, is changing so quickly. Patients are asking questions in Chat GBT and Perplexity, and not just Google anymore. And we have a term, we call it answer engine optimization. Some people call it geo. Um, you know, it really ensure you want to be there when people are asking those questions. So that's the other frontier that I think is happening, and it's happening so quick. So that's the other thing I see, those two things coming together with modeling, and again, it allows us to be more personal in a compliant way.
Yeah, definitely need to be dialed in on the evolution of AI. It's evolving so fast in all everyone's life. This is not specific to healthcare. This is more of a general comment. So as marketers on the phone, make sure you're taking time to looking in how is your website structure for AEO optimization? How are your audience? How are they using the uh, the chat GPTs and perplexities and Geminis of the world to get information, and how are you cited for those sources? So all that, not for today's conversation, but that's just a general looking in my own personal crystal ball, that I would say if you're not doing that, you should be doing that, and getting prepared, because it's here, it's not coming anymore. So let's kind of wind things down for a minute here and bring it to really, some parting thoughts on things. So Lindsay, what's one thing attendees should leave with today? You've said a lot of great things. You talk about starting early, which is so important, getting stakeholder buy-in. But is there anything else you want to kind of lean into here, or just kind of restate for our guests?
Absolutely. So I think aside from starting early, is Rick mentioned earlier, it is okay to start small. I think a lot of people get overwhelmed when they want to launch a new campaign or a new channel or enhance a channel. It's okay to start small as long as it's statistically, falls within the realm, and your partner will guide you on those numbers and all of that. And then I'm going to do two, Craig, and then trust your partner. At the end of the day, you're choosing to work with a partner because they bring a level of expertise that you and your team may or may not have, and that's okay. So at the end of the day, choose someone that you trust, start small, and let the data speak for itself, and you will be able to make a data-driven decision.
Yeah, that's so true. There's so many great partners out there, and you can't have all the expertise in house. And sometimes people say, oh, well, I'm just going to go hire person X or person Y. Now, sometimes they don't bring all the skill sets. Maybe they're a great addition, but really, seek out a partner, do a thorough evaluation process, and find one that is the right fit. And then that's where the magic happens. Rick, what's your parting thoughts here for the folks on the line?
I would just say that, we've talked a lot about growth, and that really comes from precision. I mean, modeling lets you focus on the right patients. It really allows you to spend more efficiently, and it's really that, as Lindsay said, start small. It's that crawl, walk, run kind of mentality. I think that will help in terms of your management, in terms of spending on this and proving that it works. And then again, being able to provide you the data to back up your result really will help you with the next phase. And that's whether you're new to modeling or whether you're already using modeling. If you're already using modeling, then we like to say break it down, right? Break it down at the localized level so that you can figure out how to tweak your existing models to make them even more predictive and more effective.
Yeah, I love that. Well, great. Well, Lindsey, Rick, thank you so much for joining us today. We did have a few questions come through. So, Lindsey, I'm going to start off with you. What surprised you most once you started using predictive modeling? And you can't say the results because you've already said that one.
Not going to say the results, I promise. I'll say,
what didn't you expect that was a surprise, right?
okay, I think what surprised us the most is how different the plans looked at an individual location. So they all look different from a quantity standpoint and even from a decile standpoint. So having that predictive modeling really shaped and changed the way we approach individual location growth plans. And then the second part of the question, I would say we actually saw a reduction in the number of leads that were coming in, which at first was like a uh-oh moment.
Right.
But then once we realized we were receiving less leads, however, we were receiving more qualified leads, which is a great problem to have because then our team was actively engaging with a more qualified prospective patient than they were previously. So that was a surprise for us, a very welcome surprise, but I would say those are the top two.
Yeah, but culturally, what a challenge, right? I bet you had your concierge team or call center team freaking out, right? The phones aren't ringing. We're not getting this much. But when they started to convert, you're like, we weeded out the junk, right? That's what you're
saying. Exactly. So they really appreciate that and they're fully on board now. And you know, when you see that increase in call volume specifically from direct mail, a lesson learned was also like, let's stagger these pieces of direct mail when you're talking about a couple million pieces that you're getting ready to drop. So that was a lesson learned too, like stagger when they hit the mailboxes so that your team is not overwhelmed during a short period of time when you see those influx of calls coming in.
Yeah, no one wants long wait times.
No.
So you want to make sure that your clinics are staffed appropriately when campaigns are going in. So that's great advice for our listeners today. So hey, Rick, how does predictive modeling help reduce wasted spend compared to more traditional segmentation or demographic targeting?
Well, we touched upon some of this, but when you think about list selects, instead of targeting using broad demographics, like age or income or even how close they are to a location, models actually score individuals on their likelihood to take action, right? And it's and that means we spend less on low propensity audiences. So you're focusing your money and your campaigns on those prospects or patients who are most likely to engage, and that reduces spend. Again, I point back to a lot of the case studies, including Lindsey's, where everything was about how much they were able to slash their cost for acquisition. Even though you're creating some customized strategy, you are actually reducing the cost because the campaigns are much more successful. And by the way, not just from a data perspective, the creative teams, you can utilize the information from these modeling and data analytic exercises in order to create imagery and headlines that are, again, going to tie into that. And again, those two things together make the campaigns much more successful.
Yeah, so what you're saying, Rick, is the information that you learn from the model on who they're targeting can inform creative and messaging strategy. That's so valuable.
Yeah, at the end of the day, I rarely have been in a meeting where somebody doesn't say especially with growth, the number one KPI is, you know, getting new people to sign up or getting new patients or et cetera. I mean, that and cost per acquisition is so important, reducing the cost per acquisition. I don't see a lot of budgets increasing in the next couple of years, right? I see, again, how do you do more with less? So that's really what modeling does. And try it out. That's the key thing.
Yeah, great. Hey, Lindsey, one more question just came through as we were chatting here. I'm going to serve it up to you, but you know, someone wants to know, what are the early wins or quick signals that helped prove the value to maybe some of the skeptics that you had in the organization? Anything that came to mind?
Yeah, we, aside from the reporting that Rick and the team provide to us, we do have internal real-time reporting. So I'm part of a live feed every time our patient experience team schedules an appointment. And I will say there were days where that live feed got muted. I mean, we wanted to celebrate them, but those new appointments were coming in and they were coming in quick. And so for us, that was signal number one, obviously, when we're getting them in and scheduled. And then number two would be they're coming back, right? They're coming back for a second and third appointment. So really early on, it was all about getting those first appointments scheduled and the quality of leads that were coming in.
Yeah, and you just hit on something that's so important. I'm glad this question was asked because we missed it in our prepared comments. But you know, it's not just that first appointment, right? Because you've identified people that look like your current patient group, you know that they're going to come back time and time again. And that's where the really long tail effect happens. So when you're looking at the analytics here, don't just look at the first visit, look at lifetime value of a new patient, what that looks like for you, because that's where the really ROI comes in to be supercharged.
Absolutely. It's a long-term play.
Yeah. Well, that's great. Well, Lindsey, thank you so much for your time today. Rick, thanks to you, and thanks for the folks hosting today. Dan, appreciate you doing the polls. I think that's about it, and we appreciate everybody's time in joining us. Recordings and other supporting material will be sent out via email.
Yeah, thank you, Craig. I'm sure the audience joins me in thanking you, Lindsey and Rick, for that terrific discussion. And thank you to everyone in our audience for taking the time to join us today. Please note that if you asked a question and we weren't able to get to, we'll do our best to get a response to you. We'll also be sending out a link into the webinar recording. Watch out for that within the next few days. That concludes today's program. We hope to see you at future forum webinars, and mark your calendar for the Healthcare Marketing and Physician Strategy Summit, May 4th to 6th, 2026 in Salt Lake City. Please visit the forum website at healthcarestrategy.com to learn more. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you and have a great day.